When you just think in terms of an impact figure of 485, you can measure it and it tells its own story.
This is not about numbers, it's about people. Behind the numbers are individuals. They're little kids whose dreams of a life of fulfillment has been cut short. It's about parents who can't go to work or to tend their farms because they're sick.
This is a major step forward. And this is something that we need to celebrate because it is true that great work has been done, lots of progress has been made, and 485 children did not die today because of the work that's been done in global malaria control. That doesn't mean we can stop. 2,000 children did die today of malaria, and this is something that is a continuing, avoidable tragedy.
You know, I'm a pediatrician, and when I first moved to Africa in the mid-1990s and worked for a maternal child health NGO, I was just so struck by the burden of malaria, and that when I wanted to think about what more could we do for the health of women and children in central Mozambique, you couldn't get past the idea that unless we did something about malaria, we couldn't achieve any of the goals that we were setting for ourselves for maternal and child health.
When I was a physician, and when I was every day seeing all these children lying on the floor of my clinic, all of them with severe malaria, and a lot of them dying. When I look at this figure, 485, I just realized that maybe if we had all these means 10 years ago, and all these people working together, we would have been able to save a lot of these children lying in the floor of a clinic in an endemic country.
We have a group of scientists working on the biology of the mosquitoes, the Anopheles mosquitoes that transmit the disease. All mosquitoes don't transmit malaria. Most are resistant to malaria. It's a subset of the Anopheles that become infected and transmitted. And the mosquito doesn't benefit. Are there ways we can engineer mosquitoes to make them resistant so that they would be able to survive better than those that are transmitting malaria? Building a better mosquito may sound ludicrous, but these mosquitoes would outcompete the other mosquitoes, thereby driving down the populations that can transmit malaria.
United Against Malaria is a campaign that really catalyses football to open new doors and new audiences to the fight against malaria. It's a campaign that's been running since 2009, really with a focus on the World Cup. And we've engaged corporate partners, NGOs, footballers, federations around this one campaign called United Against Malaria to really use football as a way to get messaging out there and also engage new audiences.
As part of the United Against Malaria campaign, we've distributed BetNets to all of our staff members in countries that are affected by malaria. We've also purchased the United Against Malaria bracelets for our team as an effort to raise awareness around malaria and the importance of using the nets. And so those are some of the efforts that we've done inside the bank, in addition to our overall wellness programs and information sharing.
We believe at Nandos that we have an obligation to give back. And as a chicken restaurant, we're not really out writing big corporate sponsorship checks. So for us to get involved with an organization where we could bring our relationships and feel like we could really make a difference, and malaria, as you know, is preventable. It's treatable. It was something tangible that we could actually make a difference, and it's the right thing to do.
I think that word "continue to focus" is really important because we've got such tremendous momentum that we've built over the last 5 years and covering almost 700 million people with nets, and now we're bulking up the medication and the rapid diagnostic tools. We're going to need funding of several $1 billion a year for the next 5 years. So we need to ramp up our efforts to bring in more donors, to persuade existing donors that if they want to reach the maternal and child health Millennium Development Goals, we must first take care of malaria.
I'm pretty convinced with the collective political support as well as funding from our donors and our Congress, and with sticking to the plan, using the tools that we know work, we can get very, very close to 0 deaths by 2015.
Getting the Nobel Prize, that was a special day, but getting involved in malaria is maybe more special. Probably a lot more important.